As a few states start reopening businesses and others make their plans, the coordinator of the White House coronavirus response cautioned that we should expect some form of social distancing through the summer. We're getting some insight from Dr. Arthur Pancioli, chairman of the Department of Emergency Medicine at the University of Cincinnati College of Medicine. Dr. Pancioli, good to see you again.
Good to see you, Sheila.
So does it concern you that states are on so many different pages when it comes to starting to ease restrictions?
It does. You know, it's interesting. The best example I heard is someone describe this as that we need a unified dimmer switch, that we can turn things up slightly and turn things down slightly in response to what we see as the effect of easing restrictions.
How would that work?
Well, it's like anything else. Our society has done a marvelous job of self-distancing and social isolation, and in doing so, we have really slowed this pandemic. As we ease restrictions and certain groups, preferably low-risk groups, begin to come back out and encounter one another, we will see some increase in cases of COVID-19. If those cases rise too quickly, we could again return to some restrictions, ideally not as tight as we are right now. But if we're thoughtful and careful and gradually do this, being very mindful of the cases that present, we'll be in a much better position.
So I saw a picture in the New York Times of some folks out on the beach in California. I mean, they were just crowded onto the beach when they reopened this weekend. Gym owners in Georgia are talking about all the people who are calling in wanting to get back in the gym. What are your biggest worries about some of these types of things that we're seeing?
Right. So in order to do this right, we have to make sure of a couple things. Do we have the capacity to handle an increased number of cases? And right now we do. Do we have the thoughtful plan of reopening in such a way that we won't get a flood of cases and overwhelm that capacity? And when you see large gatherings returning to pseudo-normal, we can anticipate a rise in cases. And the concern is we won't see that rise till a few weeks after the people have gone back out and encountered one another. So we have to be a little slower and a little more thoughtful as we're doing this.
Governor DeWine has said he does want to be slow and thoughtful in reopening things in Ohio. Now, he also announced last week that Ohio is going to be able to test a lot more people. There are things happening in that arena right now. So what does that mean for us?
Well, undeniably, testing capability, for example, at our facility, UC Health, our testing capability is going up tremendously. And what that does is if we know who has the disease when they are sick and or who has had it in the past, we will be able to make better decisions about who can come out and when, and we'll also be able to make better decisions about, what is happening in terms of case rises.
Are there any new medical discoveries or developments that you've been reading about or seeing in effect that are giving you any hope right now, Dr. Pancioli?
There's nothing in the immediate future. There are so many tests being done. The vaccine is a long ways off. There are no immediate drug discoveries that I think are all that immediately hopeful. The convalescent plasma that's being used, I'm very impressed with the early results with that, but they're very early.
So I'll ask you sort of what I asked you the last time. What do you want people watching to know? And this time I'll just add a twist to it. As things start to reopen, what do we as individuals and families need to do?
Sure, and there are a couple things. First, thank you for the open forum, because one concern I have is that in the emergency department where I work and in emergency departments across the region, we've seen a decrease in the number of people presenting with things that we know are out there, for example, heart attacks. I have a grave concern that people are so afraid of coming to the hospital that they're ignoring really important symptoms. And those symptoms on things like heart attacks and strokes should not be ignored. And it's much more dangerous to not come to the hospital.
Do you think people think it's unsafe to come to the hospital?
It's not unsafe to come to the hospital. We've done a very good job of keeping patients segregated, using our PPE, and keeping things clean and safe.
That's good to know. And then you would go on with the rest of what you were going to say.
Sure. People just have to be smart. We all want to get back out there, right? We all want to do it as quickly as possible, but we can't do it all at once. And we need to be tested when it's available. We need to be thoughtful. If a business reopens and that business is really smart and they use all the cleaning that they can do and all the social distancing they can do within their business, that business should do well. And we should make sure that we are watching the organizations and the businesses we work with. We all need to work together. We need to be thoughtful. We still need to have some patience, or we're going to get back in trouble.
Dr. Pancioli, thank you so much for that great information, and once again wishing you and all of your coworkers well. Hope you can stay healthy.
Thank you.